What's the real cost of dealing with hair loss, unwanted hair growth, and acne? And I'm not just talking about your wallet, but also your time, your mental emotional bandwidth, and your self-esteem. I'm naturopathic Dr. Hussain, and this is Face to Face, the Hormone Health Show. If your bathroom counter looks like a Sephora shelf, this episode is for you. We're getting into the financial costs of dealing with unwanted hair growth, hair loss on your head, and skin. We're going to talk about the mental emotional toll that these conditions can take, how to figure out what's actually going on, and what are the kinds of things that actually work, because I want you to spend your time and resources on the things that will move the needle forward. Sometimes we think about these concerns as just cosmetic ones, but often there's a reason why they're happening. Not just that, we oftentimes don't think about the invisible load that these concerns come with. The time you spend thinking, looking up things, researching, going to appointments, looking at older photos of yourself and comparing yourself to that version of yourself that no longer exists. And we live in this world that sends us all kinds of messages about how we should look, and that comes with its own baggage. So first, let's dive into the mental emotional load and the financial costs that these things can come with. Hair loss, hirsutism, which is unwanted, thick, coarse hair growth that can happen on your upper lip, on your jaw and chin, on your back, on your chest, on your inner thighs, as well as acne, bring in a lot of people into my practice. And a lot of these patients are PCOS patients, so polycystic ovary syndrome patients. The other chunk of those patients are perimenopausal patients because there's a lot of hormone change happening at the time. And the other two groups are usually postpartum and pubescent patients, so going through puberty and all sorts of things are happening at this point in time as well. A lot of these patients have spent tens of thousands of dollars on their skin and hair. And they continue to spend thousands upon thousands of dollars every year to manage it. And that's a huge load in and of itself. The things that people are spending their money on include anything from skincare, so think creams, moisturizers, serums, procedures like PRP, which stands for platelet-rich plasma, chemical peels, microneedling, laser hair removal, supplements like collagen, biotin, which actually doesn't work as well as you think, other hair, skin, and nail combos, detoxes, cleanses, probiotics, you name it. And actually, most of these supplements don't have a lot of data on them to show us that they're effective in addressing things like acne. Then there's also out-of-country expenses. So in Canada, where I am, there's lots of regulations around what can be done and what can't be done, what's regulated when it comes to skin and hair treatments. So some people, for either cheaper options or for options that are unavailable here, go out of town to get these treatments done. And then there's unvalidated hormone tests. The main testing that's actually really helpful for us to understand what's happening with your hair is actually routine blood tests. We'll get to that a little bit later. But apart from these financial costs, the costs that we don't talk about are the mental emotional ones. The time that is spent scouring Reddit to go on TikTok and Instagram and gather lists and learn about what may or may not be happening. Staring in the mirror and really spiraling when you catch yourself in non-flattering lighting. Traveling to appointments, scheduling your appointments, finding a practitioner, trying out different practitioners, bailing on time with friends and family because you feel insecure. This is a very common experience people with acne, people with hair loss, people with facial hair growth experience. Self-esteem can take such a huge hit. I cannot even tell you how many tears have been shed in my clinical practice in my office, and people are always apologizing for their unshaved legs and for their toenails not being perfect. And I don't care about those things, to be very frank with you. No healthcare provider cares as much as you do, right? Like, we are hypercritical of ourselves. We even don't extend ourselves the same self-compassion that we would extend to someone else that we love, someone else in our life. And here's the thing, we think about these body hair growth changes or hormonal hair loss on the head or acne as these temporary transient changes, right? Like, if we think about how we have historically been taught about acne, that at puberty, everyone gets acne and then you'll grow out of it. But for a lot of us, it's actually rooted in genetics, and it's rooted in a lot of other factors that are happening in your health. So we're not thinking about it as this temporary thing, and we need to think about this as this chronic thing, because acne can actually be a chronic health condition, just like someone with migraines, right? Like you treat someone with the occasional headache differently and transiently or temporarily or as on an as needed basis versus someone who experiences chronic migraines. That person will have to manage their migraines very differently than someone who gets the occasional headache. So a lot of us have to shift our mindset around like what we're experiencing at the same time. And this is an unfortunate but very real reality and very real conversations I have in my clinical practice. It's something I had to come to terms with myself as well because I have PCOS and I had cystic nodular acne. I still have some of the destruction it's left in its wake in terms of scarring. And that's the other piece, right? Like oftentimes these things do leave destruction in their wake, like scarring, like hyperpigmentation, like lesser hair on your head. And it's really hard to reconcile with that. And you're not alone in that either. There's so many of us who feel that way. And part of growth and part of moving forward is to figure out what works for you and what's happening. And also knowing that your body changes and it's not going to go back to the way it was very likely, but we can still move forward in many, many ways. The other aspect of this I think we need to talk about is like this femininity piece, right? Like because a lot of these symptoms challenge these ideas and constructs of femininity we have out in the world where we get marketed to shrink our bodies, to shrink our noses, to shrink our bellies, to have clear skin and to have perfect skin and to have like great hair, long luscious hair. And these are beauty ideals that have been fed to us in so many different ways, in so many different places from a very young age that they are inherently present in our psyche. And ultimately, like that also, for lack of a better way to put it, it messes with our brains a little bit, right? Like, and how we identify with ourselves and these changes that are happening. And we've internalized it. I grew up in Pakistan. I mentioned this in the first episode. And Pakistan ranks as one of the worst countries for gender disparity. And the internalization of Eurocentric beauty ideals is like nothing I've experienced before, but also like that's my only experience because that's my background. But it's very prevalent across the world where colonization has happened. And I was always called dark at a young age. Like, thankfully, I didn't care so much about color. But like, those are the things that a lot of us are also facing, right? There's layers upon layers upon layers of this kind of messaging that we get from marketing. And now we have like these social media platforms that have filters on them. And some of it is, preying on our insecurities. But we're also like seeing this shift toward people being more real and raw on there. And I think if you are someone who's only seeing curated material, I will highly encourage you to broaden who you're following and maybe unfollow people who make you feel bad, because real skin looks very different than through a filter, through different lighting. Even if you're watching me right now on YouTube, then my skin looks very different than it would in real life, right? Like, I also have makeup on. I have like a ring light right here. I have natural light over here. This is a camera that you're seeing me through, right? So I feel very privileged in my career and in what I do that I get to see people really up close, because it has normalized so much about myself that I thought was wrong and that was imperfect over time. The stretch marks that I got when I was going through puberty, and right, I didn't even grow that much. I'm like 5'1". I'm 5'1", and I gained like 20 pounds, 10 to 20 pounds at the time when I was going through puberty, but I got stretch marks all over my calves, all over my butt, right? Like, and that is a hard thing to swallow. But then I started looking at my mom, and she was like, yeah, I got stretch marks really young too, and her siblings, and they got stretch marks really young. So there's that genetic component that made me feel a little bit better. But also seeing my patients up close and seeing all kinds of different bodies, people without makeup, their acne, their eczema, rosacea, melasma, it has normalized so much for me. And like I said, I feel very privileged to have gone through this experience and continue to see very real bodies up close, because I think if we had more transparency, if we actually like looked at everything with more kindness and just from like a very neutral lens, we would see that bodies come in all shapes and sizes and they look very different. So I really love this movement towards showing like bodies in different angles and bodies in different lightings and bodies throughout the day, right? Like you wake up flat and then you put food and water, as you should, into a body and it changes. So all of these things are very normal and real things that happen. And I want us to hold those very real things in mind as we're addressing some very real concerns that you might have, like the acne and the hair loss and the hirsutism or the excess hair growth, because it's not just cosmetic, A, but B, we have to also make sure that we're not falling prey to like marketing schemes, right? Like, because if we think about how these things make us feel, and I've fallen prey to it too, don't get me wrong, we all are human at the end of the day. Now, let's switch gears and talk about why you might be experiencing some of these things, because there might be very real like nutrient deficiencies or hormonal changes and even genetics. Even if it is genetics, yeah, we can control that, but how you manage it, it will affect it. It will affect like your long-term strategy, how you talk to your doctor. And I want you to have a solid foundation to even just have better conversations in your health appointments. So first up, let's talk about hair loss. So I want to set the stage first. So let's take a step back. On a very regular basis, we lose 50 to 200 hairs per day. And this is very, very normal. So the amount you lose per day might actually differ based on like how frequently you shampoo your hair or massage your scalp or oil your hair, for example. Any kind of stimulation can loosen up the hair that's already going to fall. So the frequency of that stimulation may determine how much you lose on a regular basis. So for example, if you only shampoo 3 times a week, you might notice more hair fall on those 3 days and not as much on the other 4 days of the week. Very normal. Now, there's different patterns that we can lose hair in. You can lose hair diffusely, so it's just all over, not in a particular spot, and you're just noticing thinning overall. The most common cause for for that kind of hair loss is going to be a nutrient deficiency, like iron deficiency, vitamin D deficiency. And those are very testable things, right? Iron deficiency is the most common global deficiency in people with periods because we lose blood all the time. If I take a look at my own practice, the amount of people who come in knowing that they have iron deficiency and still don't take their iron is astronomical. And let me lay this out for you. If you have low iron, you will lose hair and then you will not be able to grow the hair back in the way that you want to. Period. So if you're iron deficient, please take your iron. You need to take it consistently. 5 milligrams per day is likely not going to make a huge difference. You likely need a supplement and not just be relying on iron-rich foods, but please do still eat iron-rich foods and make sure to retest at regular intervals. So typically, like if you're iron deficient, we supplement for a minimum of 6 to 8 weeks before we retest to see if your levels are coming up. If it's giving you symptoms or if your levels aren't coming up, then we switch to a different iron. There are many, many, many different forms of iron. Don't not take your iron because you're tolerating it poorly. Talk to your healthcare provider and get a different iron. And then the goal really is for you to be at a normal level. Then if you have other symptoms at the same time, so let's say you're feeling really cold and you've had a little bit of weight gain and your mood is off and you're also losing nails, then we also want to investigate your thyroid. We might want to look at autoimmunity. So sometimes in autoimmunity, you have diffuse hair loss and inflammatory conditions, but sometimes you actually lose it in patches, and this is called alopecia areata. And then sometimes you lose hair 2 to 3 months after a stressful event. This is called telogen effluvium. So this is when the hair that was already going to fall in the next little while falls out all at once because you went through something stressful, whether that be physical stress like an injury, immunological stress like you had pneumonia, or if you went off a medication, or if you started a medication, or you're postpartum. And the thing with postpartum and perimenopausal hair loss, I think, is that there's lots of things happening at the same time. You're going through many different changes. There's hormone change happening at the same time. You might have nutrient deficiencies, and all of those things are layered atop one another. And that's what oftentimes happens with hair loss. The other kind of hair loss that you can get is hormonal hair loss. So hormonal hair loss, if you think about how older men and sometimes younger men lose hair, it's around the hairline and at the top of the head. And that is driven oftentimes by testosterone. And that is mostly genetic. Some of us just have more testosterone in our skin, like myself included, my family included. And that's also what causes actually a lot of hair growth where we don't want it, like that thick, coarse hair growth around the upper lip, jaw, chin, back, etc. For that kind of hair loss, the sooner you intervene, the better. For any hair loss, the sooner you intervene, the better, because then you'll keep your hair. But for hormonal hair loss especially, the thing with hair loss is that most people don't notice their hair loss until it's already gotten to the 50% range, as in like you've lost 50% of your hair-ish, and that's when you're realizing. So you want to stop it sooner rather than later, and we'll get to how after we talk about acne and hair growth. So the reasons why oftentimes people will have like body hair growth and acne, I already said one of them, it's the testosterone in the skin or the genetics that are driving that. In something like PCOS or polycystic ovary syndrome, it's like, yes, the testosterone, but also some of the metabolic dysfunction that's contributing to all the hormonal issues that are happening. Then there can be some like other lifestyle factors. There's a perimenopausal hormonal shifts that can contribute, because if we think about perimenopause, our relative ratio of estrogen and testosterone is changing too. So as in like before, like when you're having regular menstrual cycles and you're premenopausal, you have estrogen that is a little bit higher even on a baseline level. And then as we approach like menopause and get closer to menopause, especially, that estrogen starts to come down, not in a linear fashion. It's usually really erratic. And actually, our next episode is on perimenopause, so we'll talk a little bit more about it then. But in this case, the testosterone doesn't change as much and estrogen changes significantly. So that relative ratio changes, and how that can present really changes as well. Let's talk about food and this relationship to acne, because you may be surprised to hear that there isn't a huge amount of data we have that shows that any singular food has an impact on your acne. Even though on social media, there's a lot of statements and rhetoric that your gut health is really related to your acne. I'm not saying that there can't be a relationship, but there's no linear relationship. The only exception to that is dairy. So dairy in some cases can increase cystic and hormonal and nodular acne in some individuals, but the easiest way to figure that out is to eliminate it for around 2 to 4 weeks and then reintroduce it and see how your skin does. Because not everyone will respond to it. It's only a small percentage of people who will. Sometimes the relationship with food actually has to do with the regularity of eating and the nutrients you're getting exposed to. And oftentimes that will also relate back to how you're actually feeling in life and in your body. So let's say you're going through a lot of distress and you're also feeling really bloated, and you also aren't making like the most nutritious dietary choices and drinking alcohol and drinking tons of caffeine and replacing your fruits and vegetables with like sugar sweetened stuff. Then yes, right? Like there's that stress component, lack of sleep component, maybe the inflammatory nature of just like the alcohol and the burden on your body from stress. And then also we're not giving your body the resources that it needs to actually take care of you and your skin. Here's the thing, your skin and your hair is just not as important as the insides of you, like your brain and your organs, right? So your body will divert resources accordingly. At least that's how I like to think about it. I don't know if that's scientifically true in that sense, but your hair is just not as important. Your skin is just not as important as the rest of you. So now that we've talked about why you might be experiencing what you're experiencing and what kinds of tolls it can take, let's move into what you can actually do about it. Because I think there is a lot that you can do. And the first step is always going to be to track and keep a good inventory of what's happening. So let's say we're talking about acne, take pictures, write down all the things that you've tried that have worked or not worked, because that actually does help us understand if you used something in an appropriate way, like at the right timing, in the right sequence, and also like the right ingredients and for long enough. Because oftentimes I will get patients that, oh yeah, I used a cleanser for 2 days and it broke me out, and then I stopped using it. And it's hard to say if it was that or if it was something else, right? Because oftentimes we're also making multiple changes all at once to try to get relief from whatever it is that we're experiencing. For hair fall, one of the things you can do is actually make a hairball in the shower and either take a picture of it or compare it from time to time. And then taking pictures, but when you take pictures, take it in a similar way, as in like in the similar lighting, whether it's wet or dry, like keep it consistent, because you can't compare wet to dry because your hair clumps and behaves a little bit differently. If you have dandruff or if you have seborrheic dermatitis or some sort of scalp issue, you want to make sure that you're writing that down and the kinds of things that you've tried for that. Is your acne cyclical? Your period app is probably a great place to note that down if it's, let's say, before your period or mid-cycle or with your period, whatever the case may be. Or maybe there's no relationship with your period at all. That also gives us information. Those are the kinds of things that you want to notice. Even for facial hair or body hair, you can take pictures. Or if you get laser hair removal, how frequently you're going and if that frequency has changed. So the information gathering point is really important because it helps set the stage for you to communicate better with your healthcare team as well. Then get help sooner rather than later, because the sooner you get help, whether that's family doctor, naturopathic doctor, nurse practitioner, dermatologist, a hair specialist, the better it will be. The more hair you can keep on your head, the less scarring you might have, the more access to actual interventions that you need you'll get, right? Like Testing, for example, is a great place to start when you are looking at something like hair loss. Iron and vitamin D are easy to test. Thyroid is easy to test. If you have something like PCOS, right, then we can actually identify that's what's happening and address your PCOS in multiple ways, even though it's hair and skin. Working on your insides and your hormones on the inside and your metabolism on the inside can actually be really helpful. Same thing with perimenopause, same thing with postpartum, same thing with puberty, right? So don't just start taking biotin. Biotin actually has really poor data for hair growth, but that's oftentimes where people are starting. The simplest place to start is blood work and talking to your health team, and then moving forward from there. For hair loss, we have lots of options actually, like topical solutions. So ketoconazole shampoo, you might know that as Nizoral. Zinc pyrithione shampoos, the most common brand would be like Head and Shoulders, for example. We have minoxidil, also known as Rogaine, topically that can be used. Pumpkin seed oil topically can be used. Saw palmetto, caffeine can also be topically used. There's lots of different formulations, but it really depends on what is the issue and what is the best solution for that issue. And then you might need to do a bit of trial and error as well. For shampoos, you actually do want to leave them on for a minimum of 2 minutes for them to actually have an impact. If you're using topical solutions, you can likely layer a few things in imperfectly. The thing with science and scientific studies is that we usually study one of these ingredients one at a time. We don't like layer them throughout the week and see like what happens when we use them synergistically or when we use them in XYZ way. And that's because we're first trying to identify what is most effective for a certain thing and if it's actually helpful or not. And then maybe one day we'll get to a point where we layer some things in a study itself. But I find that in my clinical practice, oftentimes when we layer things in imperfectly, they still tend to help. And the thing with hair loss is whatever you do, you likely need to do it forever, especially if you have hormonal hair loss. So doing something that is practical and sustainable really does matter here. For example, if you use Rogaine or minoxidil topically, you will first lose hair on it because that's just how it works. And then the hair regrowth will start. And then when you stop using it, you will likely lose the gains that you had. It's not that you're going to lose more hair. Your hair is just going to revert back to if you never used it at all sort of situation. Okay, and these are the kinds of conversations that we need to have to figure out what kind of solution is best for you. For acne, there are, like I said before, not many supplements that can be helpful. There's a little bit of data for zinc, for example, especially if your dietary intake is super low. There can be some benefit with topical and maybe even oral green tea, but some of the most effective solutions for acne actually come from pharmaceuticals or from conventional medicine, and that would include something like the oral contraceptive pill. It decreases free testosterone. So the testosterogenic acne that you get, that's cystic and nodular, that's happening on your cheeks and your jaw, for example, or even your back and your chest, that is actually very well addressed by something like the birth control pill, especially if you're also looking for contraception, right? Like that can be a good option. I'm not saying that's the way you need to go, but that's oftentimes why it's being prescribed, especially in PCOS. It has multiple layers of benefits. Then there's something called spironolactone that we oftentimes use. Again, like in that PCOS population, it's used more frequently because it addresses 3 things that happen at the same time, which is acne, unwanted hair growth, and hormonal hair loss on the head. So that is one that can be used. And there's also other medications similar to spironolactone and even minoxidil, that Rogaine medication that can be used orally. But those need to come with contraception because if you get pregnant on them, if you are someone who is sexually active, then they can cause fetal abnormalities. So when a baby is developing, it can lead to congenital malformations, and we obviously don't want that. In terms of topicals for things like acne, the main things that are going to be helpful are the things that have been around for a long time, right? Like retinols, vitamin C, niacinamide, SPF. I can't not talk about SPF. SPF is your best friend regardless of what age you are and regardless of how you want to age in terms of your skin. If you have acne, it's especially important because UV damage will lead to more inflammation in the skin, and prevention is the best path forward. It also will help protect your skin in the long run from wrinkles and premature signs of aging. So SPF is really, really important. Use the one that works for you. I have no recommendations on that front. Maybe we'll get a dermatologist in the future to help us through that conversation. And then I didn't talk about Accutane. Accutane is one of the other medications for acne that's used very frequently. Comes with its side effects, but can be really effective, especially for that cystic nodular acne that doesn't really respond to other things like antibiotics or benzoyl peroxide or other measures. So there's lots of solutions out there. It just needs to be catered to you and also your age, right? Like when you're young, we don't want to use a ton of like strong actives, especially in this day and age. The younger population that's using a lot of actives is quite high and alarming. We actually want to make sure that you're getting the care that you deserve and that you need, because even acne comes in different forms and shapes and sizes, right? Like it could be fungal acne, for example. Some of it is not acne at all, but more like a keratosis or something else that's happening. So you want to see a specialist to identify what's happening and get the best care for that particular concern. Facial hair growth is hard. Facial hair growth, there's not many good solutions out there apart from the spironolactone that I had mentioned and getting it removed and getting rid of the follicle. Even with PCOS patients who are well managed, oftentimes the thing that we're trying to affect is maybe like how the hair is coming out, because once the follicle is active, it's active. It's not going anywhere unless you destroy it through some sort of intervention. But sometimes what we see is that the hair will come out a little bit thinner, a little bit slower than it used to as we start to get a little bit older, have a little bit more intervention and strategy in place to address the PCOS as a whole. All of that to say, there's lots of different options. There's no wrong way to approach it. But sooner rather than later is always better, and getting professional help versus spending all your time and money and resources on, TikTok promoted ingredients and skincare. And sometimes this other thing happens when you have your acne and or hair loss and or body hair growth under control. And then you go through like a significant time of hormonal change or stress. And then those symptoms come back. And that's not a failure on your part. It's just a thing that happens because of changing hormones. So your management strategy probably needs adjusting over time. And that's, again, not a failure on your part. It's just a thing that comes with time and age and living in your body and living on this planet. And more is not always better. I hope that came across. Sometimes a few choice ingredients is all you need with a little bit of professional medical grade treatments. If you have an underlying strong genetic predisposition, your management strategies are likely going to be different than someone who doesn't have that. I want to reiterate the one thing I said earlier, that if you want to keep the hair on your head, you likely need to do things forever. And then you get to decide how you want to do that, right? Like if you reach a point where you're like, I don't care about this anymore, that's fine. And if you do that and then you decide, I really do care about this, that's fine too, right? Like you get to make the rules here, and that's totally fine. And sometimes you also might need a little bit of like mindset and mental emotional support, not in a like go and love yourself regardless of what's happening kind of way, but more in the recognition of your self-worth is not tied to the amount of hair on your head or the clarity of your skin. You live in this body that does so much for you, and ultimately I want you to get the support that you need, and sometimes that includes mental emotional support, and it really helps move the needle forward. That's it for today. If you have any questions about your hair, skin, or hormones, leave me a DM or note. If you have PCOS or you know someone struggling with PCOS, check out the last episode. We talked a lot about it, and all of those links I'll throw in the show notes for you. Thanks so much for listening. I hope you learned or relearned something that will help you along your journey, and I will see you next time where we're talking all about perimenopause.